Welcome to Innersight, Health Optimization with Rudy and Shaun.
Hi, Shaun.
Rudy,
Welcome. It's our sixth podcast. Can you believe it? 6 months.
time flies.
We've had a great time so far. Getting some information out about the marginal decade, how to get to the marginal decade in our lives, and it's been a good learning curve for us as well.
Absolutely. And we've received some feedback from some of the listeners. I don't know if you want to touch on that.
Yeah, it's quite interesting because we both medical families and spouses, brothers, grandfathers, fathers, and then obviously we are in the community as well, mountain biking, and we've had a little bit of mixed feedback. So from the medical community, they think we might be pitching this a little bit low, whereas I've heard a little bit of the other side as well in the mountain bikers and the other guys around that are not medical, that we might be pitching it a little bit high. So, and because most of our listeners will be non-medical, we're going to try and get the information through, but in more layman's terms.
Yeah, I think it's always difficult to get that balance right. And as you said, the bigger part of the population listening to the podcast will be non-medical people. So we need to speak in the language that they'll understand. So
Yep,
we're going
absolutely.
to try and keep it as simple as possible and stay out of the technical bits. But to stay with the literature and academically correct, you sometimes need to lean towards the correct way of doing it as well. So it's all about the balance, and we'll try our best, and we'll appreciate some feedback on that as well.
Yeah, and today we have to talk about statistics again. So you have to know what your chances are of getting dementia. So that's what we'll be talking about today. Is the fourth of our horsemen neurodegenerative disease, which is pretty much dementia. So we'll talk numbers, and also then we'll link to a few journal studies that actually backs up what we're saying. So. Yeah, I think we've laid a good base with our first few podcasts. So today might be a little bit quicker because we've done quite a lot of the things we can do, but we're gonna speak about dementia today. So, or I'm going to call it dementia, but in the pocket of neurodegenerative disease, there's quite a bit.
Yeah, so there's a couple of diseases there, but we will mainly focus on the two big ones, which is Alzheimer's disease and vascular dementia. But in the packet, there's other things like Parkinson's disease and Lewy body dementia and other things. But we'll mostly touch on the two that I've mentioned.
Yeah, it's quite interesting in South Africa because our population is not that old. We haven't been focusing on dementia as much, and you hear about the like we talked about in the previous, the metabolic disease, diabetes, and heart attacks a lot more than dementia. But our listeners will reach that age where dementia will become a problem.
Absolutely. So in South Africa, we've got a relative young population, and I think it's around about 9%, 9.2% of the population is above 60 years of age. And that forms about, like, if you work out the equation, it's about 5.5 million people. It's not a lot. The other problem is that we've got a two-tier type of health system, the public health system and then the private health system. So the private health system caters for about 16% of the population. The rest will fall into the public domain. Now, in the public domain, they very much focus more on primary care. And the more advanced stuff is always at the academic institutions. So dementia and dementia-related diseases isn't high on the radar for prevention or intervention and things like that. Also, if you go look at what the World Health Organization, I think that was the 2020 statistics, said that only about 1% of our deaths are related to dementia diseases, Alzheimer's, dementia, and things like that. So we've got many other problems in the country, and dementia is not on the top 3 or even featuring anywhere on the list of problems.
And that's quite interesting. I mean, when we studied, it was very low on the risk or on the radar then. And I mean, the first time I really had something major to do with dementia was when my mum actually got it. So then you actually start reading, and because it was a psychiatric disease for us as medical students, and unless you worked in psychiatry, it was not really a disease that you thought about except for the odd patient. And then by the time they got dementia, they were pretty much locked away and died very soon after, which is quite sad.
No, no, absolutely. And statistically, it doesn't feature high. But if you, as an individual, if you are touched by dementia, a family member, I mean, in my case, both my uncles developed vascular dementia. In your case, your mom developed Alzheimer's disease. So then it's a completely different story. Then you don't care about, you know, um, the broader population. Then it's about your family and your friends and the people you know. And obviously, we've seen it, and that's the one thing that you don't want. You don't want to lose your mind.
And if we talk about that now, you don't want to lose your mind. What we want to talk about today, there's actually a lot you can do, but you have to start so early. And where we are now, we have to already be doing stuff at our mid 40s, early 50s in that time to make sure that by 70, 75, that you're not attacked in the brain.
Absolutely. And we've talked about this in the cardiovascular bit. The disease starts 10, 20, 30 years before you actually get the diagnosis. And I think there's been a shift in thinking about it, or a paradigm shift in worldwide in dementia and related diseases, is that people starting to talk about prevention or delaying the disease, whereas no one mentioned that words in the past. As you said, you were treated in the psychiatric ward if you developed some depression or other symptoms with your dementia. So, yeah, it's exciting times, and there's data coming out that you might prevent or delay it, and that's very positive.
Yeah. So again, lots of the studies we will touch on was done in the UK, US, because their populations are now doing or getting to the 80 plus, where if we go back to what you said earlier, in our private system, there's a lot of people getting to the 80 plus. And if we talk about the Innersight, there's a lot of our people that will get there if they do the first few steps that we've talked about so far, they will get there. And if we talk about what to do, so we're going to have a list because we think there's a golden ticket to actually lower your chances by around 40% of not getting dementia.
Absolutely.
Yeah.
Absolutely. So obviously, a lot of these diseases develop with age. And in South Africa, if you were born in 2021, life expectancy for a man was 59 years of age, and for a female, 64 years of age. So that's essentially age before the you know dementia diseases starts. Um, but there's a part of the population that are aging. And if we look at the what's happening in the country, people are getting older these days. So definitely, we'll see it in the future. And the people that's entering in our, so I think this is also like a little disclaimer, is that the people entering our program or our patients as such, usually in the age group of 35 to 55. Those are the guys that want to do something. We've got purely got a preventative health clinic, um, but they will age with us. And at some point, we'll reach the 65, 75 age bracket. So we really need to focus on what can we do today to prevent or delay things going forward.
Yeah, and there's obviously some nutrients, some supplements you can take that we'll talk about. So we'll talk about how not to get Alzheimer's, how not to get vascular dementia, and what other things we can do in lifestyle changes or lifestyle augmentations to actually get us to a very good 80. Yeah, and like you say, it is so interesting. And I mean, we are in that boat and we live it every day. So yeah,
Yeah.
interesting. S-
Maybe you should kick off with just saying something about Alzheimer's disease.
yeah, so Alzheimer's, obviously named after Dr. Alzheimer that looked after a specific patient that he thought he saw them in an asylum in those days. They were locked away in an asylum. And when he did the autopsy, he saw some changes in the brain. And afterwards, when he died of a cold, not of any Alzheimer's related. But then the disease was named after him by his the people that followed after him, and it's still a little bit of a misnomer. There's a lot of diseases that look like Alzheimer's, but I mean, the main thing that we talk about is memory loss. So, and the main anatomical thing that we see in the brain is that the brain has got a very specific look. Not that all of them do, but most of them have the amyloid plaques when they're seen on autopsy, and most people know it from what they've read or what they've heard is the memory, but you can have a lot of other symptoms. You can have balance symptoms, speech symptoms, you can have muscular symptoms, you can have a lot of autonomic systems, so people's bowels. So it's,
So I think that's also important that often or most of the time it starts off with the memory, but it's not the pure memory disease. It affects the whole body, the whole person. And yes.
you know, and then if we look at our previous horsemen, the other thing that can happen is little strokes. So that's the piece of the vascular dementia.
Yes, yes, and that plays into the cardiovascular disease. It's a very similar pathology getting to vascular dementia. Um, I think also we as physicians like to put diseases in buckets. So we'll put a Alzheimer's disease in a bucket and we'll put vascular dementia in a bucket. But the reality is that a lot of the Alzheimer people they still have vascular problems or they still have an element of vascular dementia. Although vascular dementia is the second most common form of dementia, there's a lot of overlapping between diseases. So yeah, there's mainly two things with vascular dementia. You can get a post-stroke dementia, which is a progressive decline in cognition after a stroke, usually executive function, usually processing speed, or you can get progressive decline in cognition without having had a stroke. And that's usually by having little small strokes that you can't see. And the accumulation over time will cause a deficit in your cognition, especially executive function and processing speed, as I said. Um,
Yeah, so the main difference between the two, so if you think about the Alzheimer's, it's like a trickle down, whereas with vascular dementia, if you have strokes, you'll have these big steps down in your function. Yeah.
yeah.
So, and obviously there are other types. They are quite scarce. I mean, we're talking less than 10%. So if we talk about uh, Alzheimer's being around 60, 65 to 70% of what we see, and then the vascular dementias, and obviously then the rest. So,
Yes, yes. And then there's the Parkinson's disease, which is more a movement disorder, Lewy body disease, which is memory and a bit of movement disorder combined with some visual hallucinations that you can get there. But the bulk of the dementias, and especially what we see around here, is probably Alzheimer's and vascular. Um, uh, Also, to diagnose dementia, we use questionnaire based type of screening tools that we can test people for to see if there's memory loss. But usually it's a caregiver or family member or son or daughter that comes to the office and says, "Listen, but dad is forgetting stuff. It's not, there's something wrong with his memory." Um, so it's a clinical diagnosis in essence, it's a clinical diagnosis. So sometimes it's difficult to actually distinguish between the different forms of dementia. Yes, we try and put them in buckets and but it's not always that easy.
yeah, and if you think about it, it doesn't matter that much because by the time you've got dementia, the treatment these days, there's not. I mean, there are a lot of drugs out there, but they don't really work as well as what we're going to talk about now about the preventative part. So I mean, there's quite a lot you can actually do in the 20 years before you actually get to 70 or 65 when we actually see the dementia starting, which is loads better than actually trying to take the 15,000 rand a month drug.
Absolutely. And with the medicine, you probably, you know, within a couple of months from being going to a place of care, um, versus you can delay the disease or even maybe prevent the disease with lifestyle interventions. Um, so that's the exciting part of it. We all will have some form of decline in our cognition over time, age related, or you might have the Alzheimer's predisposition or vascular issues at hand. So we all over time will lose some of our cognition. And I think what we try to do with our clients is to start off with a full tank. So we talk about the half tank, full tank scenario where you can imagine that if you've got your SUV and you fill the tank half and you make a little hole in the tank, which is the incident, it's either your vascular risk or your Alzheimer's risk. And you drive, you might get 200, 300 kilometers before the tank is empty. But if you can start off with a full tank and you get the same little hole from your Alzheimer's or vascular disease, then you can do 500, 600 kilometers before you might end up with an empty tank. So that's the principle that we try and do with our clients. It's like, what can we do to start off with a full tank, to delay any cognitive decline as much as possible?
Yeah, so I'm gonna actually start by asking you if you had to take one or two supplements. So let's throw it around a bit so that that we can keep the people interested. If you had to pick two supplements or maybe three, what would you take, and what do you take
Three supplements. So,
to prevent dementia?
okay, so I'll put B vitamins in one bucket, B vitamins, specifically B6, B12, and folic acid or folate. Vitamin D and omega 3s. That's the three supplements. And the reason why I'm saying it is because there's a lot of data behind it.
So
Um,
if we can just repeat that, so it's the B vitamins, omega threes, and vitamin D.
yes,
Yeah.
yes,
And the nice thing is we can test for it, and we do.
absolutely. So if we test for it and you've got normal levels, you might not need it, but at least you need to be tested.
Yeah,
So
and it's actually quite a nice marker that we test now, the
uh,
homocysteine level,
yes.
that actually tells you your heart and brain health or inflammation marker in those areas, which is quite nice. I mean, with these.
Yeah, so the homocysteine is nice because you get feedback on actually three B vitamins. So it's an indication of your vitamin B6, vitamin B12, and folate levels, more or less. So if the homocysteine is raised and you take those B vitamins, then you'll lower your homocysteine levels. Um, the lab values, and I think we've mentioned it in the previous podcast as well, the normal value is way too high. So we need it much lower than that. So we're aiming for around about 8 to 10 at least with the homocysteine. So taking B vitamins, if your homocysteine is elevated, then you need to take your B vitamins. And and the studies show, well, I mean, there was a, a big consensus statement on homocysteine specifically, and they've taken 20 years worth of data and looked at it and came back and said that plays a big role in dementia prevention or delaying the onset of dementia.
Yeah, and I think that that's why it's so critical to test this, because as you get older, your absorption of your B vitamins actually get very bad, or it reduces markedly as you get older. So you have to maybe test, and if you're not taking it in very well, is think about maybe doing trochets, injections, or intravenous. That's uh, been found to work. Yeah,
And it's a low hanging fruit. It's cheap. It's easy to test for. And if you can get a 30% reduction in dementia from doing that, I mean, there's no drug that can do that.
And I think that's probably why it's not out in the being screamed from the top of Table Mountain. Is there's not a lot of pharmaceutical companies actually making money of telling people to go and take your B vitamins, and
Mm.
the same with omega threes. I mean, it is quite a cheap-ish drug, and so if it's a drug, a supplement, and a lot of people make it. So, and again, if we talk about omega threes, you have to take quite a lot. You have to take between 1 and 2 grams per
Yeah, at
day.
least, yes. But it's one of those things, omega 3. Um, we know from
E-
sorry,
Epidemiological studies.
studies that people with low omega 3 levels, or people that doesn't eat fish related food often, they've got a higher incidence of dementia. So we know that. What we don't know is if we supplement, if we'll actually decrease the incidence of dementia. That said, there was a 2017 study that showed that if you've got the ApoE4 gene variant, that it does make a huge difference in delaying dementia.
That while you're talking about the ApoE 4, the, that means you've got a risk genetically programmed that you can have a higher incidence of dementia. So that's something you can test. And if you've got a double gene, you've got a 80% raised chance of having dementia early. So, and those people have to supplement with omega threes. That's critically important. I think if we talk then about the VID, I mean, me and you have got to be in our bonnets
Uh,
about VID D3, because I mean most of the people we tested Innersight are low on VID D3.
yeah, and we in sunny South Africa. I mean, we've got sun all year round almost, and the people we test are low in vitamin D. Um, so you need to be tested. You can't just assume that your vitamin D levels are normal. Um, and that's also low hanging fruit, easy to fix. Uh,
And there are very nice new products out that you don't have to take every day. You can take it every 2 weeks, and uh, I just think for me that's almost the first thing I take is vitamin D3, and I mean, I've never actually seen someone that is toxic, and there are people taking up to 5,000 international units per day, and they run around 50 to 60. We like to keep our clients between 40 and 50, but most people, so if you're deficient under 21, and most people test deficient.
no, absolutely. And I mean, yeah, you definitely want a higher value. And yeah, I use the spray, which is quite nice. It's just one tablet less to drink, and it's two sprays in the mouth, and it's done. Combined with the vitamin K2, so that it goes to where it needs to go. Um, and I mean, there was something published now, article published now this year on vitamin D supplements, and I
Tested
think there
about
was about
500,000, was it?
oh, I think this one, that 12,000 people in the study with the vitamin D one, um, where they've looked at people taking vitamin D and people not taking vitamin D, and they followed them up over a 10-year period of time. And afterwards, the group that took the vitamin D level, they've had a 40% reduction in dementia development. Now, you can say there's healthy bias in the study, because it might be that people taking vitamin D might be more health conscious and exercise more than people not taking vitamin D. But even so, if a health conscious, if you exercise and take your vitamin D and omega 3s causes a 40% risk reduction, then why not?
Absolutely, and it's actually not that expensive. So yeah, that's definitely one of the things. So you can test for your vitamin D3. You can test your homocysteine, which pretty much points to your vitamin Bs, but you can actually test all three of those vitamin Bs that we talked about
Yes.
in your blood, and then you can also, there is a way to test your omega 3s if you want. My personal thinking on this is just supplement. It is such, again, it's not that expensive, and just add it as if you eat 2 or 3 times a week,
Mm.
eat fish.
Yeah.
So,
And absolutely, if you've got normal values, you don't need to supplement. So know your numbers. You need to know your numbers. Get tested, know where you are, and then you can take supplements, and it might make a huge difference going forward.
so while we're talking about know your numbers, there are, if you talk about the previous podcasts we've done, there are blood pressure numbers and then diabetes numbers. That's the other two things. Your metabolic risk, or your your um your your functional risk is the other thing we can test for. So to keep your pipes open is pretty much how I want to say it in layman's terms. You have to get the blood to where, so you, the stuff that you've, what we just talked about,
Mm.
that you're taking, you have to actually get it to the brain, and in the pipes have to be clear.
I think there's many ways you can develop dementia, um, and many routes. And there's it can be from high blood pressure, from abnormal lipid profile, from low B vitamins. There's a lot of things playing into the development of a dementia picture, um, and it's multimodal. So we need to look at all the aspects. And one of them is the vascular side, and that's very similar to what we've talked about in the cardiovascular podcast. So we look at blood pressure, obviously, and we've mentioned the sprint trial previously, where they looked at the blood pressure systolic of 140 versus 120, and 120 was just so much better. Now, they had a leg on that called the sprint mind trial as well, and came back with the same conclusion, that a reduction in mild cognitive dysfunction in in the people that's the blood pressures were controlled better. And then they've done a big study as well. I think 30,000 patients, 15,000 had blood pressure, 15,000 without blood pressure. And they've looked at that. And if you control the blood pressure, then you've got a 12% reduction in developing dementia, and something like a 16% reduction in developing Alzheimer's disease, just by treating the blood pressure. And now we're talking about the vascular factor, but I say a reduction in development of Alzheimer's disease. So yet again, there's a lot of factors playing into the end result, which is the dementia picture.
Yeah, it's quite interesting when we're not talking on the podcast, we are talking about patients all the time. And I mean, we talked about this week about, should we treat this blood pressure? Yes. Should we treat the cholesterol? Yes. So it's, I mean, it was actual patients that we looked at the values. So those are the two big things for the heart. So let's say you have to talk about the heart must be, what's good for the brain, what's good for the heart's good for the brain, and then what's good for the liver and the pancreas is good for the brain. So that's the other part, is obviously the cholesterol there, and also the insulin. So.
Absolutely. And we know if you've got type 2 diabetes, then you've got a increased risk for developing dementia related disorders. So blood glucose control is very necessary that you focus on that as well.
And in that, even not just your blood glucose, your insulin, that fasting insulin that we talked about, that level is the thing that we focus on quite a lot in our
Yeah.
testing. So
I think with dementia, that it's also it's a complex. The disease process is quite complex with dementia, because remember, with the glucose, they've got the GLUT1 transporter in the brain, which is insulin independent, but still you've got the increased risk of developing dementia with type 2 diabetes. So there's a lot of things we still don't know about dementia. I think that's important. We don't know everything about dementia. There's a lot of theories on how it develops. And if you look at the plaque in the Alzheimer's, the new drugs that's dissolving the plaque, the
don't really
results
work.
is
Mm,
not that good. So it might just be a symptom
mm.
of a process that starts earlier. I see there's a lot of talk about the blood-brain barrier, and thinking maybe the pathology lies there, so that things can cross to the brain easier if the blood-brain barrier isn't intact. So yeah.
Yeah.
Um,
And then, I mean, there's another big thing that we haven't touched on, which is actually like most of the previous podcasts, is also a golden ticket, and that's exercise. So again, it's if you move and you move in different ways, you're going to have your chances are going to be up to 40% less there as
Yeah.
well.
So of all the interventions to try and prevent or delay dementia, that's by far the better option.
That's your golden ticket.
That's your golden ticket.
Yeah.
Exercise.
And it actually doesn't have to be that much, eh? I mean, just house
No.
cleaning is is one of those things that can. In that British study, they said
Yeah,
up to
that was a
12%.
that was a massive study of about I think it's about 500,000 people that they enrolled in this study, and they followed them up for about 10 years, and it showed that if you do um, exercise, vigorous exercise, then you get the benefit of the reduction. But even with gardening and just household tasks, you've got a what was it 21%
Yeah,
reduction, something like that.
amazing.
Um, so, yeah, the exercise is an interesting one. Um, I've read another study where they've compared BDNF, which is a type of protein that excretes when you do exercise, and it helps with the brain. Um, a 6 minute high intensity interval is more than enough to raise it quite high. Um, so at the end of the day, it's not necessarily a one specific type of exercise. It's exercising. You need to do something, and you'll reduce your risk.
Yeah. So in that sense, you're using your brain while you're exercising, number one. So and in that is also balance, and there's quite a few things. So if you're walking on uneven terrain, it's a little bit better than walking on a straight road. If you're riding on a bike, it's even better because you have to balance. But the main thing is to get that heart beating a bit quicker, but not too quick. So you don't want to do high intensity exercises all the time. And that brings us back to the zone 2 stuff again. So quite interesting because the zone 2 builds your mitochondria. It makes the cells stronger and actually literally stronger that they can make more energy. Um, which is amazing. I mean, if you think about it, like 40% reduction by moving more. So, and we're talking about five to 6 days a week, moving more than you used to. That's yeah,
Yeah, no, it's crazy to think about it. 'Cause that's the one thing that we all should do. We should exercise. Um, they've also, I mean, people who has developed dementia or already diagnosed with Alzheimer's and things like this. If they get them to do some form of exercise that needs coordination, like dancing, as an example, it does provide some improvement in their cognition. Mm, and it's probably because you use more. And I'm getting back to the full start with the full tank. I think when we're young, in the early days, that 10, 20, 30 years before you might develop the disease, you need to practice these things. You need to do things that challenge you every day. Balance, challenge your exercise capacity. Make sure you've got all the building blocks from a nutritional point of view. Um, and toxins, toxins is another thing that you're going to try and avoid, um, to not cause problems and dementia, like example, alcohol. Now, there's a lot of controversy around about alcohol, and the studies are conflicting evidence, but we all know too much is going to be a problem.
yeah. The newer research seems to think less is more, less is better. So,
Mm.
and I mean, the 2 drinks a day type ceiling is also there, but um, we definitely see that 2 drinks a day after that
Yeah.
it's harmful. But yeah, and then there's another thing we haven't talked about is sleep, which is, I mean,
Another golden ticket.
yeah, it's I mean, when we grew up, like, and these entrepreneurs that said, no, but we only sleep 4 hours a day and we work and
Yeah.
work and
No, we'll
work,
sleep when we're dead.
and that's been turned on its head completely. Eh?
Mm.
It's we know now it is an absolute golden ticket. The Matt Walkers of the world has showed us that that is actually how it's almost the toilet of the day for your brain actually to get rid
Yeah.
of the nasties.
Absolutely. So you need that deep sleep for the cleansing part, getting rid of all the stuff in your brain at night. That's a cleansing part, and you need the REM sleep to fix the memories, basically. Um, so they've also done a study on people between their 50s and 60s and looked at the hours that they've slept and showed that they've used 7 hours as the benchmark of as normal, which is debatable what's normal. But the people that slept less than 6 hours or 6 hours or less, they had a 30% increased risk for developing dementia later in life. And that was at the age between 50 and 60. They've done the studies on. So another golden ticket, 30%,
It,
exercise 40%.
yeah, that's amazing. And I just want to come back to the full tank. The way we use our brains. I mean, we get born and then we start to walk and we look at the world and we learn, and then at school and then university, and then you actually in your vocation you learn, and then you top off sometime probably late 40s, mid to mid 50s, about what you normally do. So, and if you don't from there on learn a new skill or new hobby or dance or become a beekeeper or whatever, or new language, or a new instrument, play an instrument or chess or something that actually challenges your brain. I mean, it's been shown that putting someone in a dementia home is actually the worst thing you can do, because you pull them out of that social network that they have to function in, and they literally fall off the cliff then. But at some point you cannot function as a dementia patient inside the world, and by the time you move there, that is pretty much your end ticket. So, and that's what we're trying to move away from. You have to challenge your brain. It's not a muscle, but it is like a muscle. You have to really challenge it with balance, with trying to learn new things, work out something different. Yeah.
Yeah, every day we should try something new. And yeah, start a new sport. Try something new. I mean, that's why we do mountain biking. I mean,
Yeah.
the challenge is there in balance and frames per second passing you when you go down a hill between trees and rocks and stuff like that. Just train your brain.
Yeah, absolutely. Yeah, and I think, like, for everyone listening, I mean, we've talked about a lot of things, and dementia has not really been worked out to say, but that is exactly what you should do, because I mean, we don't even know how memories are properly formed and stored, but what we do know is what hurts the brain, and that's what we've been talking about now, is things that you can do to keep this brain as alive as possible. And that when someone does or do a CT scan of your brain at 65, that they're not that the report doesn't come back brain atrophy, because I mean, if your brain shrinks, it doesn't work. And I mean, that's actually one of the things that you will see on a Alzheimer's patient's brain, is it's small. So and the way to get your brain bigger is using it and getting food to it and challenging it. Yeah, and actually making itself repair itself with stuff like sleep and the option not to have toxins. Yeah.
Yeah. There's one thing that we can just touch on as well, which is shown in the literature also to have an effect on dementia, and that's dental health. And we might get one of our dental friends in at some point to chat about dental health and how it can affect your body. But definitely with gum disease, with that the gingivalis organism, big association with Alzheimer's disease and vascular disease um, with that. So go for your regular dental checkups as well, because
Yeah.
that might also make a difference going forward. So it's all these little small things, but if you build or put all the blocks together and you build and build the wall, then you build some resistance against what might happen one day.
Yeah, and I think that's the thing when you see our report. I mean, it's not rocket science, each one of them on their own, but if you put it all together, the risk can be massive or small depending on what you're doing with this body that you've been given. Yeah.
And it's not the one fit the same thing for everyone. It's your report will different from mine. I might need to take B vitamins and vitamin D and not omegas, and you might do the opposite. It all depends on what we find. Figure out your risk, figure out your levels for certain things, and then personalize that approach to your journey,
Yeah.
um, and take it from there.
Yeah, that and that's quite interesting for the Innersight uh, program is what we're working on now is to build a modular program, which will be quite nice. We will be rolling it out soon, making this almost like a 5-year project for people to try and get to their their best
Yeah.
self.
Yeah, you'll always have those that want to do everything at in one go. But a lot of people, we find it's a bit overwhelming for a lot of people to just digest all the information in one go. So hopefully with the modular approach, then we'll take little bits at a time and guide you. So also with the base program, we'll pick up certain things and say you've got a bigger vascular risk or you've got a bigger metabolic risk, and then we can first focus on those areas and build on from there with the idea to do everything over time.
Okay,
But yeah,
and that's the other thing we're quite looking forward to is, I mean, we had to get quite a lot of information across in this first 6 months, just trying to tell people what the big things are, but we'll be making small videos from now on, things that we've been talking about, numbers, and just keep the information coming. I mean, because people want to know, and then I think now that the Four Horsemen is done, we are now looking forward to the nice things you can do. So these were the things that were going to kill you, but looking forward, we're going to talk about things that can make your life better from now on. So which is exciting.
yes,
So
absolutely.
yeah. Oh, amazing. 6 months, and now next 6 months, we'll try and get another episode out early in the year, and then yeah. But in the meantime, we'll do the small videos, and yeah, please give us some reviews and feedback. It'll be nice to know what people see.
No, absolutely.
Thanks, Sean.
Thanks, really.